Hi everyone, welcome to Pharmacology. So we'll continue with the pharmacy exam multiple choice questions. So first question, procedures for the safe handling of anti-neoplastic agents include all of the following except. Options are use of lever lock syringe fittings, wearing double layered latex gloves, use of negative pressure technique when medication is being withdrawn from vials, wearing closed front surgical type gowns with cuffs, use of horizontal laminar flow hood. So here the wrong statement is option E, that is use of horizontal laminar flow hood. In order to prevent the drug exposure, a vertical flow laminar hood, not horizontal, should be used when an anti-neoplastic agent is prepared. The other precautions mentioned in the question are important safety measures for handling parenteral anti-neoplastics. All pharmacy and nursing professionals who handle these toxic substances should receive special training. A 16-year-old girl stops by a pharmacy on her way home from school. She says to the pharmacist, I have been using Crest white strips daily to bleach my teeth in preparation for my spring formal. However, my teeth are becoming very sensitive. Each of the following statements is advice that the pharmacist might suggest except which one. Options are there is a possibility that you may damage the gingival tissue and tooth pulp. Oxidizing agents may have the potential for mutating or enhancing the carcinogenic effects of other agents, for example, tobacco. Bleaching teeth is best done under dental supervision. Next option is tooth sensitivity is not related to the frequency of use for such products. And the last option is the most common ingredient in products responsible for teeth whitening is hydrogen peroxide, which can cause sensitivity. So here the answer is option D. Teeth whitening agents usually contain a peroxide based ingredient which can penetrate the surface area of the tooth to whiten. Cosmetic agents can alter the normal flora or cause tissue irritation, gingivitis, and teeth sensitivity. Antiseptics have been used as cosmetic whiteners, for example, glyoxide, along with hydrogen peroxide, for example, Crest white strips. A woman who has not been in the sun for 4 months develops redness on her chest after lying in the sun for 20 minutes. The next day, she applies a suntan lotion and develops the same degree of redness on her back in 2 hours and 20 minutes. What is the likely SPF, that is sun protection factor, of the lotion she is using? Options are 14, 10, 12, 9, 7. So here the answer is option E, that is 7. The SPF or sun protection factor is the minimal erythema dose, that is MED, of the protected skin divided by the MED of unprotected skin. So protected skin means the skin in which the suntan or sun lotion has been or the sunscreen has been applied. So from the question it is understood that the minimal erythema dose of the protected skin. See here, the next day she applies a suntan lotion and develops the same degree of redness on her back in 2 hours and 20 minutes. That is the MED of protected skin. Protected skin means after applying the suntan lotion, it is 2 hours and 20 minutes. So 2 hours and 20 minutes, it's total 140 minutes. Okay, that is mentioned here. That is the MED of protected skin is 140 minutes divided by MED of the unprotected skin. Unprotected means those that not applied the suntan lotion, which is 20 minutes. So 140 divided by 20 minutes, that is equal to 7, which is the SPF of the particular lotion she is using. Which of the following cleansing products would a pharmacist recommend for a patient with inflammatory acne? Options are an abrasive facial sponge and soap used 4 times a day, aluminum oxide particles used 2 times a day, sulfur 5% soap used 2 times a day, mild facial soap used 2 times a day. So the answer is option D. For patients with inflammatory acne, the best product is a mild facial soap used 2 times a day. The soap should be gently rubbed into the skin with only the fingertips. Cleansing products that irritate already inflamed skin should be avoided. All of the following statements concerning contraindications with chronic use of over the counter analgesic agents are correct, except which one? Options are aspirin, ibuprofen, and naproxen sodium are contraindicated in patients with bleeding disorders, peptic ulcer, and the third trimester of pregnancy. Second option is aspirin, acetaminophen, and ibuprofen are implicated in Reye syndrome. Third option is acetaminophen is contraindicated in patients with active alcoholism, hepatic disease, or viral hepatitis. So, out of these statements, we need to find out the wrong one. So, the answer is option B. Aspirin is the only analgesic agent associated with the development of Reye syndrome.